My name is Dr. Laura Gallo. I'm a faculty member at Boise State University, and I'm here to present the fifth video in a series of 6 videos related to children's social emotional health and wellness during the COVID-19 pandemic. Just as a reminder, each of the videos does have a accompanying tip sheet to help you with some of the words and phrases that I'm using in these videos so that you don't have to remember them. So this next video is related to breathing and how breathing is a mindfulness activity that helps us relax and better connect with our physical body and to regulate those emotions. So breathing exercises are helpful for everyone, but especially children who struggle with calming down and regulating their emotions. Breathing exercises can help reduce stress and anxiety. Teaching breathing exercises before a child is in crisis or having a meltdown will help them access the deep breathing and a sense of calm more easily in the future. So this first activity is one that generally has some words that you would want to read to the child, and it does use a flower. So sometimes it's nice to have props and things that we can use in these different activities to help engage the child, make it more interesting for them. So getting started, what you would want to do is offer an opportunity for the child to find a space that would really help them get into the activity and to relax and to get in touch with their breathing and what's happening in their body so that they can more easily remember what that feels like. So sometimes it's nice to have the child lie down on their back and get comfortable. Ask them to close their eyes and breathe in and out like normal. We could then ask them to place one hand on their belly and the other on their upper chest. Ask them to breathe in, counting to 4, and move the air down to their belly so that the hand on their belly moves up as they breathe in, but the hand on their chest stays still. So instead of breathing into their chest, they're breathing all the way down into their belly. You would ask them to hold their breath for 4 counts and then breathe out. So the hand on their belly should move down as they breathe out. So ask them to do that for about 5 minutes, longer or shorter depending on their attention span, but the idea is that they start to recognize what it feels like to do those deep breaths. And there's a lot of physical benefit to being able to incorporate deep breathing into your practice. So after they've practiced a little bit with their deep breathing, we are going to move into the actual activity. So if you have access to a flower, it could be any flower, preferably one that's alive, but doesn't have to be. And it doesn't even have to be a real flower. It could be a dandelion, just something that they would be able to use as a kind of a prop in the activity. So you're going to ask the child to breathe in through their nose for a count of 4 and to smell the flower. So they're actually practicing really breathing in, trying to smell that flower as they breathe in, and then hold their breath for a count of 4. Ask them to breathe out through their mouth or their nose. Doesn't matter, whichever's more comfortable. And then repeat the exercise for 5 to 10 minutes or until the child feels relaxed. So you can actually ask them questions about how they're feeling in their body and see if they're able to put those feelings into words. So we're trying to help them recognize self-awareness and what's happening for them so that they can be more in tune with that. So you can also tell your child to visualize an imaginary flower if you don't have access to a real flower, but a real one tends to work better. So that's just one quick breathing activity that you can incorporate. It should be something that doesn't take a lot of time, but can be really powerful and helpful for when they are trying to learn how to emotionally regulate. Thank you.